My name is Nafisya Irdina binti Muhammad Suhaimi. So today I'm going to talk about eczema. So I chose eczema among children, which is atopic dermatitis. So for introduction, eczema, or also we call atopic dermatitis, is a common skin condition marked by itchy and flame. It's also often seen in babies and young children, appearing on the faces of infants. Eczema can come in variety of types of children, teens, and adults. For risk factors, as we can see here, patients usually get this by many factors, which is living in a developed country, a city, or a cold climate. Secondly, patient was to being exposed secondhand smoke, and patient being overweight. Thirdly, patient was being treated with antibiotics in infancy, and lastly, they being born by cesarean section. After that, signs and symptoms. Patients usually have dry skin. After that, itching, which may be severe, especially at the night. They will also have small raised bumps, cross over when scratched. Also, their skin will be thickened, cracked, and scaly. Lastly, it will raw, sensitive, swollen skin from scratching. The type of atopic dermatitis. Atopic dermatitis is the common form of eczema. It usually starts in childhood, so I chose disorders among children. They often fades milder or goes away by adulthood. Atopic dermatitis is common in children but occur in any age. Atopic dermatitis occurs equally often in men and women. 3% of adults worldwide struggle with atopic dermatitis, which is a chronic form of atopic dermatitis. And lastly, atopic dermatitis occurs in people of all races. So for recommendation of treatment for atopic dermatitis, patient needs to moisturize their skin at least twice a day. They have to apply an anti-itch cream to the affected area. They have to take an oral allergy medication. They also have to apply bandage. Patient needs to take a warm bath to avoid their skin become itchy. Patient also need to choose milk soap without perfume or dyes. Use a humidifier before sleep, and don't scratch to avoid your skin become swollen from scratching. So for counseling for patient atopic dermatitis, they need to have medical information, coping with scratching and itching, and care of their skin. Patient also need a relaxation training to calm their self from scratch. They also got education problems because of family. Last but not least is recommendation products for atopic dermatitis. First is Vanicream moisturizing skin cream. Patient need to use this cream, apply as often as needed to face, hands, feet, and body. Second is CeraVe moisturizing cream. Patient need to liberally after cleansing or after bath or shower, as often as needed or as directed by your physician. Thirdly, CeraVe healing ointment. Patient need to apply a small amount of the ointment to her lips and eyes to keep the dry skin at bay. It effectively acts like an eye cream and lip balm in one. Fourthly, Aveeno Eczema Therapy Itch Relief Balm. Patient need to apply liberally over affected area as needed or as directed by a doctor. For external use only. Avoid contact with eyes, stop use, and consult doctor if condition worsen, symptoms persist for last more than 7 days, or if new symptoms occur. Lastly, Cetaphil Baby Eczema Soothing Lotion with colloidal oatmeal. Patient need to apply liberally to baby skin as often as needed. For best result, use after bathing.